Thank you for the great kickoff, Congresswoman Schwartz. And thank you to the BMA for the opportunity to speak with you all today. Good afternoon. My name is Michael Sturmer, and I am an executive at Lavongo, an applied health signals company focused on empowering people with chronic conditions. As I thought about our time together today, I'll admit it was a challenge for me to know where to begin. So much has transpired over the last year for all of us in healthcare, from a policy perspective, and personally, as each of us have had our own experiences during this pandemic. Even small things, like this conference, for example, has been an adjustment. A pre-recorded approach to the conference is new to me. But I've tried to look at the bright side of things throughout COVID. And the good news for me and for most of you is my jokes are guaranteed to be hilarious, because that is how I will envision my virtual audience, laughing out loud right on the punchline. Kidding aside, I really did struggle with where to start. So I thought I would share a personal story to help break the ice. Over the last years, my dad has dealt with cancer. And as you would expect, he's had numerous physician visits. I tried to be with him at these appointments, and I'm lucky enough to have the means and the flexibility at work to attend several, but certainly not all of the visits. He's just a short 3-hour car ride away. Squeezed in between my active work and travel schedule, I would join him. When I was able to attend, the visits seemed more informative and helpful for both of us. The information was clearer, questions were more complete, and we could talk about what we heard afterwards, retaining much more of the information with more clarity and more confidence in what we just heard. But when I wasn't there, it was very different. I could always tell there was information missing, large gaps, or significant parts omitted or confused and mixed up. That actually wasn't really a surprise to me. He was often nervous going to his appointments, and despite being more prepared than I've ever been for a doctor's appointment, he was still off in these discussions. It would always strike me how a person who was well-educated, a former CFO, with a great ability to relate to people, could struggle to find his voice, be intimidated and unsure of himself in these visits. In some of his last visits before succumbing to cancer, and like many things during COVID, his office visits changed quickly, transitioning from in-person to virtual. And with my travel eliminated, my attendance then went to 100%. The change wasn't exactly seamless. I recall the first virtual visit after driving all the way to Long Island to pick him up, when he said, "Oh, we're meeting by video. We're meeting by video this time." So we went to his computer, where he had all of his information in his home, in his office, with notes, questions, and data in hand. And I sat next to him as we executed his first virtual telehealth visit side by side. What I observed was fascinating. He was less nervous. He was more prepared with his questions and his notes. He took better notes and seemed to retain much more information. That visit, I asked very few questions, as he and his physician covered a wide range of questions, information, and approaches. When it was done, I had 2 questions for him. First, why didn't you tell me this was on video? I could have stayed at home. But much more important, the second question was, what was the difference this time? You seemed more calm. His answer was simple. He felt comfortable, prepared, and the time wasn't rushed. But ironically, we met the same exact time as we always had with his physician. This story and this visit has left an impact on me. That virtual care can, should, and is more than just convenience. It can and should be about the consumer, the member, fostering empowerment on their terms in their lives, removing barriers and being present on their journey and how they want their journey to go. To be clear, my dad received great care, both in person and virtually. I'm very thankful for that. What I'm talking about is expecting more, broadening the value to consumers, broadening the definition of value, accelerating the momentum of behavior change that is happening right now, and creating not only a new future for healthcare, but a better future for healthcare. I shared this story as a replacement for how I sometimes start presentations, with edgy facts and interesting what-if statements. However, and I don't want to speak for everybody, but personally, I think we've all had enough edgy this year, as we've seen more disruption and change than some of us expected to see in a lifetime. Think about it. Keynote last year, and someone saying the following things as their edgy facts or what-if statements. 40% drop. There will be a 40% drop in elective admissions that may never fully recover. Or predicting that new patient visits and annual wellness visits for Medicare beneficiaries would have dropped 60%. And even as we sit here right now, the rebound is slower despite 11,000 seniors turning 65 every day. Well, at this point, you all well know these aren't predictions. This is actually what's happening right now. Another example, and an area that Lavongo looks at closely in our work in empowering those living with diabetes. Who would have predicted a 50% drop in the traditional lab-based A1C testing rates and nephropathy screening? By contrast, and for comparison, during that same time period, Lavongo has seen continued increases in blood glucose checks, where our Medicare members actually check 25% more frequently than our commercial members. What that means is we're able to actually translate those checks into EHbA1C results and understand where our members are at any point in time. And then, of course, there's the rapid growth in telehealth usage among Medicare beneficiaries. You're all very aware of this, and CMS has moved quickly and should be commended for doing so. Regulatory and reimbursement adjustments were made that has unlocked a rapidly increasing telehealth usage. Staggering numbers, like moving from 13,000 beneficiaries previously using telehealth per week to 1.7 million beneficiaries per week as of the last week of April. Utilization rates in urban areas have spiked from 0% to 30%. And on an even longer trajectory, we've seen a continued uptick in the usage of remote patient monitoring, CPT codes. These were introduced by Medicare back in 2019, and we see a 570% increase in usage in Q2 2020 relative to Q2 2019. These kinds of changes and impacts, both good and bad, do not happen in a vacuum. As I noted in my story, healthcare providers have rapidly responded to this crisis and these once upon a time what ifs by doing what healthcare does really well, reacting. And I mean that sincerely, as a compliment to all of you. You reacted, you made decisions, and you kept helping people and delivering care, just like in the story I described. Additionally, the response to acute care has been well documented. And to those in harm's way, helping people every day throughout this crisis, thank you. This crisis has also shined a spotlight on the value of real-time consumer data in areas like understanding mental health impact our outside environment can have on us, and especially those with chronic conditions. This has helped lead to a greater national awareness that mental health impacts of loneliness are all too real, and that supporting a patient's mental health is as important, if not more so, than supporting their physical health. At Lavongo, we ask our members to tag how they're feeling every time they check their blood glucose to help provide context within the reading. We do so in an effortless way that is seamlessly part of their routine checks and doesn't feel like extra added work. What we found was a 66% increase in our members reporting they felt more stressed between January and April. And these elevated stress levels have yet to subside. This increase in stress is certainly not isolated to Livongo members. We also know that access to mental health services has always been challenging, with only half of psychiatrists accepting Medicare compared to 85% in other specialties and limited to no coverage for telemental health, at least before COVID. The result has been Medicare spending that is twice as high for medical issues associated with mental health as is spent on actually providing mental health services. Healthcare is great at reacting, and we've done an amazing job, and you've all done an amazing job of reacting to this crisis. What I hope is that we can harness that reaction and focus it on an area that we have not done as well, which is supporting people with chronic conditions and preventative care, whether that be mental or physical care. So with all of this change, what we know is this: there is more change to come. The good news is we can define what that change looks like. We can create not just a different future for healthcare, but a better one. What that looks like will be up to all of us as healthcare professionals, as policymakers, as caregivers, and as consumers ourselves of healthcare. Like many of you, I've spent my entire career in healthcare. I started off getting my nursing degree, but it quickly became apparent to me and my patients that I could better serve them in ways other than direct patient care. I moved on to running hospital quality programs and then spent 15 years at a national health plan. Lastly, I've spent my last 4 years having had the privilege to be part of leading Lavongo with a wild idea focused on empowering people with chronic conditions and making it easier for them to think less about their condition and more about their lives. For the majority of my now 20-year career, innovation, digital and virtual health, and the member have been my focus. I share that with you to simply say, and to quote Winston Churchill, we are at the end of the beginning, and now we can really get started. And I could not be more excited. Our opportunities are unlimited, but I've chosen 5 to share here today. 1, eliminating geographic constraints. A virtual delivery of care removes the real constraints in today's bricks and mortar model. This creates opportunities to develop new communities that can further drive towards an always present feel and further extend the definition of care. This definition of care from caregivers now able to participate from anywhere to releasing patients geographically with the option to keep their physician if they want. Think about snowbirds headed to Florida or a senior who's moving wherever they may desire without the trade-off of continuity of care or trust they may have developed. 2, an always present new care delivery model designed for the 99.9% of the time a person is outside the physician office. That's a virtual physician office or a physical physician office. I know some of you are familiar with Livongo, but for those who aren't, let me just take a minute to tell you a little bit about us. Livongo started with a focus on removing hassles and barriers that exist for people living with chronic conditions. This means we have designed a model for the 99.9% of the time a person will not be sitting in an office visit, and that doesn't change virtually. People with chronic conditions want to live their lives with their friends, with their families, in their homes. Even the most compliant person will spend maybe 5 hours a year, which would be a lot, but spend maybe 5 hours a year with a physician. We started with a focus on people with diabetes, and we've expanded services to people with hypertension, prediabetes, weight management, and behavioral health. More importantly, we've created a platform and a model that focuses not on the disease, but on the whole person and supporting our members, allowing them to actually be less engaged in their disease, but more empowered in their lives. Through effortless data collection, personalized health signals, and a human-centered 24/7, 365 model, powered by data and advanced data science, we now service over 400,000 people living with chronic conditions, of which over 100,000 are Medicare beneficiaries in partnership with our health plans. While COVID has accelerated the usage of Livongo, our model was in place long before that. And we have methodically built the platform, expanding from commercial and doing the hard work it takes to move into Medicare, built on real-world results and demonstrating the value of contextually relevant real-time signals and always-on connectivity that is changing the definition of care. I noted earlier how we saw the data and the real-time trends that said people were more stressed, despite improvements in BG levels and HbA1c results. From there, we heard from our members actually calling us. They weren't calling us about their chronic condition. They were calling us for things like allergies or how to be prepared if they do get sick, and relatively common questions. We were actually surprised by these outreaches, and we asked our members, as we often do. We asked, why would you call us for these type issues? Their response was simple: because I knew you would pick up the phone. I knew you were there, and I trust you. This extension of care, an experience that creates space for members while empowering them and creating the trust we are always present, is the next new normal of care delivery. 3, bold leaders and followers. Teladoc and Lavongo recently announced the largest digital health merger in history. By doing that, we have brought together the global leader in telehealth services together with the leading applied health signals company. We have chosen to move and lead in a direction that consumers want. Both companies could have chosen to continue down each path alone. Instead, both chose to lead into a new one that brings together a comprehensive platform for care delivery across the full care continuum, combines clinical expertise with deeper and more complete insights to improve outcomes, and brings millions of consumers into a new way to consume care. Let me spend just another minute on what this might look like. You just heard me reference an ever-present delivery model. This combination has the potential to create the Amazon of healthcare. Amazon because of their ability to be ever-present, but allow the consumer space to be empowered. Let's take the same example I've used a few times now in identifying a trend in the increased levels of stress for people with chronic conditions. Through the use of data, we can see increased levels, and if there's something to act on or a normal anticipated dynamic. Through this understanding, we can better align the right message or health nudge and set up higher levels of interactions with therapists or the right clinician. This dynamic-driven activity both identifies the signals to take action on and which ones not to, as well as apply the action with the right level of expertise, modality, and most value to the member. Present while creating space. We sometimes get too stuck on who is leading and who is following, and who is competing and who is partnering. In an environment moving quickly, our collective market dynamics are unique and changing rapidly, in which we can all potentially compete, and in parallel, we can all potentially partner. It is the responsibility of each of us to be great leaders and great followers. If we stay anchored on servicing our members, if we keep that truly at the center of our business models and our hearts, this is not a crazy dynamic at all. 4, creating a new value equation. This equation involves being better stewards of resources and costs. Let me be clear. We should expect that digital and virtual care to be both a better experience and less expensive. There is no reason, none, why we cannot and should not deliver on both. A better experience and lower cost. What this means is while utilization increases are great, utilization alone is not success. I'll go back to what I said earlier. Members don't want to be engaged in their condition. They want to be empowered to live their lives. Focus on experiences and services that remove barriers and support and foster consumer control is what we need to stay focused on and measure. To do that, we need to focus on the whole person, which includes mental and behavioral health. By opening up the digital front door to behavioral health services and supporting not just the condition, but the person. 5, continued policy change. Do not lose momentum. We encourage innovative thinking around how to account for things like risk adjustment from audio-only telemedicine encounters and the continued innovation in the role of remote care delivery. Recognize that providers and we all can learn from the customer. Trust them, trust their data, and make the changes that align to real value. And to do that, we should be willing and need to be willing to let go of some of the traditional constraints. So as I said at the start, I truly did struggle to get started on what to say for this presentation. Getting started is hard, and it can often be the hardest step of them all. The good news is, as an industry, we're well on our way past that hard first step. Look at my story and the irony that of the many physician visits I went to with my dad, the one I remember was virtual and took place at home. That isn't an accident. Let's choose to go beyond starting, past that hard first step. Let's not wait. Let's continue to analyze, but not overanalyze. We are at the end of the beginning. So now let's get started. I want to thank you again for the opportunity to share some thoughts today. And I hope you'll join me in engaging with the incredible conference lineup over the next 3 days. In closing, I've talked a lot about the member. And what I thought I would do here is close out with letting you all hear directly from a Lavongo member. Thank you again for your time and enjoy the video.
I'm William McLeod. I am a contemporary inspirational music artist.
I just want to introduce you to my everything, my wife, Lorraine.
Thank you. I love being his everything. He's a good man.
It was a shock to me to find out that I had diabetes. You never want to be told that you have any kind of chronic condition. Even though I may have been on medications, I didn't take full control of the things that I could do. And the blood sugars were up and down. The doctor finally said, I think you really do need to be on insulin. I just thought that there could be, should be, and maybe was a better means of management. And I happen to have found that through the Lavongo system. Lavongo makes it possible to receive test strips, lancets, just by push of a button. When I test, the results immediately go up where they can be retrieved by the coach. I might be a month and a half away from actually seeing my doctor, but I'm only minutes away from hearing from Lavongo. Being a part of the Lavongo program has been very helpful. They give you great advice on diet, exercise, and lifestyle changes to keep you as healthy as you possibly can be. And in doing so, I found out that my blood sugar results, hemoglobin A1C, went from an 8.9 to a 6.9 in a matter of 3 months.
I noticed that he has a lot more energy. I noticed that he's losing weight. I noticed that he looks good.
Hey.
Lavongo really helps me be my best self, which is what I want to be at all times. That's the power of Lavongo, how I improve my A1C. It's easy to keep my eye on it 'cause someone is watching me.